Obesity is this nation's most serious health problem. It taxes the body's organs, raises the blood pressure, and shortens our lives. But obesity seems to hit teenagers even harder. As we learn from Dr. Michael Snyder, a nationally known bariatric surgeon and diet expert.
I have 3 certified centers of excellence as certified by the ASMBS, the governing organization of bariatric surgery in America and probably the world. And that's because we do what we do humanely and safely and with good results. What we did is we found that we realized that the adolescent obese population has exploded in the U.S. And I know that a morbidly obese adolescent will statistically make less money, have a worse job, have a lower chance of getting married, and the chances of them losing weight just through traditional means is almost 0. So the question is, do I doom them to 5 or 6 more years till they're an adult so I can do their surgery, or do we consider doing surgery on them earlier? And what we found is with a good regimented program under our Center of Excellence status, we can have phenomenal results and get them on the right track. It's hard enough to be an adolescent. To be a morbidly obese adolescent is an extremely difficult situation. And it's not just how you're functioning physiologically, because most morbidly obese adolescents don't really care so much about that. But because they're too young, they have that reckless adolescent mindset. But the reality is how they live their life and how they're treated is horrendous. And we're not talking about kids that are stupider or less motivated. We're talking about people that have prejudice every day. It's different. When an adult comes to me desiring bariatric surgery, we understand they can make decisions as an adult. They can weigh the risks and benefits. When an adolescent wants surgery, they just want to lose the weight and get healthy and get their life back. I wouldn't trust them to make a decision about getting married at the age of 17. Heck, how can I trust them to make a decision about bariatric surgery, which is also a lifelong commitment? What I do is I put them through more. I make them go to more psychologic screening. I make them and their family encounter the classes so they can really understand the process. I make them lose a little weight up front. I make them join a gym, get a trainer. I make them put a little skin in the game so they actually are engaged in the process and realize it's going to take real work. Once I engage them in the work and they show the commitment, then I think it's a reasonable option. And it really is the option that can change their life in a way that really nothing else could.
We asked Dr. Snyder if obesity is hereditary.
This is the thing everyone has to get, and it's really hard because whenever you see someone who's severely overweight, morbidly obese, you think, my goodness, they ate too much and they didn't do enough activity. How did they get there? The reality is their wiring is different than yours. Everyone that's morbidly obese knows 100 people that eat the same or worse and exercise the same or less and don't have a major weight problem. This is how they're wired. They gain weight with no effort whatsoever. It's not because they had bad behaviors. Now, the hormonal milieu they have, their genetic milieu, is aggravated by their behaviors and what they put in. Heck, the average American used to eat in the 70s 136 pounds of cereals and flours a year. Now we eat 200 pounds. That's going to have an impact. But the reality is that that impact is much worse in someone that has genetic makeup to be morbidly obese. Young woman I operated on, 17 years old, weighed about 380 pounds. She was diabetic, hypertensive, sleep apnea. She couldn't fit into the desk at school. She wanted to be with her friends, but she had to stay at home. She was constantly pilloried in the hallway. So she had surgery. She lost weight down to about 220, which was a 160-pound weight loss, which is a lot of weight. It's certainly not her goal, but she was back at school. She was engaged with her friends. She got a little bit of style in her life. All her medical problems were resolved or significantly improved, and it changed her life dramatically. Did I make her into a waif in Hollywood? No. What I did is I made her into a normal girl. I made her into a girl who could function, be happy, have some self-esteem, and once again, go to the Gap with her friends. That's all she wanted.